eager to have our students return. We are grateful that there's been close partnership and communication both with the Spokane Regional Health District as well as other school districts such as the Central Valley School District that has followed the guidelines of our public health officials. And we are in the process now of working with our families and our staffs to make this transition. Our community has been through a lot. This situation has ebbed and flowed in many ways over these many months. And this continues to be a period of adjustment as we carefully and slowly consider what's the best way to move forward and put our students in the best position to be successful and do everything we can to keep everyone safe. So we are excited to receive this news from Dr. Lutz. We realize that there are some members of our community that will receive this information with great anticipation. And we realize that there are some that are concerned. And we recognize that there's varying opinions. And we will continue to work closely with the health district. We will make sure that we have executed our planning related to the safety guidelines and protocols that have been laid out by the Department of Health and other entities that oversee public schools in the state of Washington to move forward with an experience for our students that recognizes the value and the incredible importance of in-person instruction and also acknowledges the challenges and risks of the COVID-19 pandemic.
Thank you, Dr. Swinyard. Superintendent Small.
Again, thank you. Echo Dr. Swinyard's welcome. Thank you for allowing us to visit with you today. We in the Central Valley School District started our reopening planning process with two major tenets to those reopening plans. And the major tenet was to follow the guidance and the recommendations of our health department, as our health officials are the ones who know this space the best. The recommendation and the approval of our board to phase in our kindergarten through second grade. Last night at our board meeting, they voted unanimously. Follows that guidance and follows that tenet that we are going to continue through this entire pandemic to listen to and follow the guidance of our health department and do so because it is in the best interest of safety of our students, staff, and community. Another tenet that we talked about in our reopening plan was to always meet the readiness level of our families to return to in-person learning. As Dr. Swinyard has said, we too know that this news will be met with anxiety of some, will be met with excitement of some, and we need to be able to, as a school system in the Central Valley School District, to meet the needs and to meet our families where they are. And we will work diligently to make sure that that happens. Secondly, I want to thank Dr. Swinyard. Dr. Swinyard has been in his role in Spokane Public Schools for many years, but in his role as superintendent relatively newly. And I have found him to be a great partner and a great thought partner in putting together this plan. This is something that we have thought an awful lot about and have been very deliberate about. And you'll see both of our school districts proceeding with that same deliberation. I'd also like to thank Dr. Lutz and the entire staff, Mark Springer, Lisa Jones, Amelia Clark at the Spokane Regional Health Department for their continued guidance and they continue to push us to do what is best for our students moving forward. We too will start with kindergarten. We'll start with our kindergarten students on October 5th, and then we'll phase in. And we'll phase in on the advice of Dr. Lutz and the staff of Spokane Regional Health Department. And again, thank you for an opportunity to address you today, and would then turn it back to Sandra.
Hi, thank you, Superintendent Small. Dr. Lutz?
Yeah, good morning all. Yeah, this has been, as we have talked about in the past, a real balancing act. I don't know how many of you can remember your kindergarten teacher's name, but I can tell you that mine was Sister Damien. And I don't know that I'd be able to remember her name if I ended up spending my classes with her virtually. So again, I think that when we look at the importance of in-person education, for all students, but especially for our early learners. This has been our priority from the beginning. Early on, as you know, I made a recommendation for remote learning for all students, but however, focusing on early learners as an important group that should be, when feasible and practical, bringing back for in-person learning. We have at the health district continue to follow the data very closely. And when I look at the data for this particular age group, we have seen only 181 cases of children between ages of 4 and 6 since July 1st. That ends up being an incidence rate of 0.02 per 100,000. So although our community incidence rate has unfortunately gone up over the last few weeks, nonetheless, we believe, based upon both our data as well as experiences both nationally and internationally, that this age group represents a population where in-person learning, while a risk, nonetheless is a very small risk, and one that we have to balance with the importance of in-person learning. So again, I appreciate the opportunity of working with all of the districts across Spokane County, and again, the willingness of Superintendent Small, Dr. Swinyard, and others to follow public health guidance. And I'm very excited by the opportunities of bringing learners and eventually other early learners back to in-person instruction. So thank you again for this great collaboration. It's been very much appreciated from our standpoint at the Health District.
Thank you, Dr. Lutz. And this is the moment where we open up for questions. If you're uncomfortable with shouting out your question, feel free to use the chat. And I will read your question for you.
Hi, this is Ayana with KH2. This is a question for Dr. Lutz. My question is, why now? Why the decision now? We know we talked to one school district who wasn't aware that this announcement was going to be coming. So my question also is, is this based in science, or is it also kind of because of public pressure?
I'm not going to, at this point, respond to public pressure. I mean, given the amount of pressure that's been placed on me and public health for many, many months, this is not a reflection of public pressure. This is a function of working with data. Again, the Department of Health has been impressing upon us at the local level to follow our data with respect to bringing children back to instruction. As I shared with you earlier, the incidence rate is very, very small in this population. I also know that the plans that have been developed by a number of school districts that are looking to do this also reflect a very calibrated approach to bringing back students into an in-person environment that is safe for them and for staff. Now, to say that we will never get cases in any age group is, again, not looking at the data. We know that it's possible, but you can't eliminate all risk. You mitigate as much risk as you possibly can. And I do believe that in this situation, given the very thoughtful approach that districts are taking in bringing back these early learners, the benefits for those learners really outweigh the risks in doing so.
Next question.
Hi, this is Doug from Public Radio. Can you talk about the specific challenges or the unique challenges of working with kindergartners? Dr. Swinyard, you heard last night from one of your kindergarten teachers who said, how are we going to explain this to the kindergarten students? It's difficult getting them to slow down enough to be able to, keep their masks on, keep 6 feet away from others. Some pretty unique challenges with this young group. How are you going to approach that?
That's an excellent question. I have remembered to my own teaching days working with kindergarten students, and those first few moments that are in our schools, there's a lot of excitement and there's a lot of adjustments that have to be made. Many of our kindergarten students, unfortunately in Spokane County, don't participate in an early learning experience, and that's work for our community to focus on moving forward. And our kindergarten teachers are amazing at teaching routines and behaviors and setting those expectations and structures and put into place. And there are many routines and expectations related to safety that those kindergarten teachers work with those students on every single year. Not running in the halls, not running with scissors, not climbing on the bleachers, washing their hands. Those are all things that we teach our kindergarten students every year. And our kindergarten teachers do that, and they work incredibly hard, and they're very successful in that. And this will be no different. They'll have to teach some new expectations and some new practices and some new behaviors. And that certainly layers on some additional challenge, but in a very similar way to other expectations we have around safety, wearing masks and social distancing will be something new that we'll work with those students around. Kindergartners, there's a lot of energy and there's a lot of excitement. And so we believe that phasing our students in slowly and methodically will help best equip us to do that. And as part of our plan, and I know that in partnership with the Central Valley School District, our phasing includes bringing in alternating groups to lower the total number of students that are there at the beginning, to make that number a little bit more manageable for the teacher. In Spokane Public Schools, that'll be approximately 10 students that will be there on those alternating school days, and really provides the opportunity for the teacher to be intentional and really focus their instruction and provide the necessary support to students as they build their capacity.
Thank you, Dr. Swinyard.
I would add just one thing to that, and I think that our parents are going to, parents of our kindergarten children are going to play a very large role in helping us make this transition. And I would encourage our parents of kindergarten students to practice wearing the mask. Get them used to some of the social distancing measures that we're going to have to take. And it's not as if we will never be within 6 feet of one another. We need to maximize the time that we're within 6 feet of one another. And if we're closer to that, it should be a short duration. And so, as Dr. Swinyard said, teaching these routines are going to be very important to us as we transition in, all the way from screening at the door, taking temperatures, and a commitment from our parents to help us as we move forward. And I also think we have to take every one of these routines as a teachable moment. We know that children may struggle with a mask, may fidget. That's going to be a teachable moment. We can allow mask breaks. We can we can ask a child to take a walk outside, take their mask off, get relief from that, but then return right back to the classroom as we move forward. And so our teachers are just amazing at working with our youngest of learners. We have our Early Learning Center, which has approximately 300 students who have returned to in-person learning, and they're students 2 to 5, and we're working with them on wearing masks and the social distancing piece. And so we're going to learn from our earliest of early learners as we move forward with our kindergartners returning to in-person. So it is going to be an adjustment, but it's an adjustment that we can make.
I know that Superintendent Small brings up an excellent point around the role that our families play in helping prepare our students. And I know this has been part of our conversations in calculus with Dr. Lutz. I have a very rambunctious 5-year-old in my home, and his ability to social distance and wear a mask is very different now than it was in April. He's had multiple months now as we are out in the community going about our life as we've had to go about it. And he's learned what the dots mean at the grocery store. And he can get his mask on now by himself and wrap it around his ear. And he understands that he can't pull it down over his nose. So that's certainly part of this calculus and timing as well, is the readiness of our students and the extent to which they've been able to experience, unfortunately, some of these social distancing and mask requirements that are expected throughout our community, not just in our schools.
You know, it's funny, Dr. Swinyard, because I have a freshman who I'm teaching those same things to.
We do have a question from Amanda Raleigh, and the question is, Is there a path forward for in-person learning for grades 3 to 12? And will SPS create a COVID-19 dashboard? And the same question goes to Central Valley as well.
Yeah, so we are going to move per Dr. Lutz's guidance slowly and methodically. We're beginning with kindergarten. We'll be evaluating the conditions on a weekly basis and determine the appropriateness of adding additional grade levels. As we move up the grade band, we will continue those conversations with Dr. Lutz and what the conditions are in Spokane County and make the decision that's necessary at that time. Just like any factor of this pandemic, trying to forecast what might happen has been extremely difficult. So we're going to make the best decision in the moment based on the guidance of our health officials, and that will continue to be our practice, and we'll stay in close communication with them. We, again, just want to encourage our community as a whole to follow the social distancing guidelines and requirements of wearing masks. The more that we work together and partner as a community in doing that and following those, the quicker we will be able to return all of our students to in-person instruction. And that's evident as you look across our state. There's different case counts in different counties across our state. And there's room for improvement in Spokane County. Every place there's room for improvement, you can always do better. And we need to work together to make sure that we are really being focused and following those guidelines.
As far as the dashboard, Central Valley School District already has a dashboard. It is on our website. We have a 2-week count that that is updated every single day. It is updated as total positive cases and also broken down by school where those cases are. And we also have close contacts. One of the things that we have to be very, very clear about in our communication with our community is workforce availability. And we may not have an outbreak, but may have close contacts who are quarantined, which may cause us to have to cancel a class based on teacher availability, based on sub availability. And so we want to be very transparent about that, and we will continue to do so.
One of the advantages between Spokane Public Schools and the Central Valley School District is we have trained all of our teachers on distance learning, and we have now trained all of our students on distance learning. So we are well equipped in a way that we weren't previously to be very fluid and respond to the need for in-person or distance learning in the event that small groups of students need to be quarantined or potentially an entire class. So we believe that is one of the advantages and one of the hallmarks of our careful and diligent planning throughout this process is to prepare our staffs for multiple different scenarios.
All right, and we have a 3-part question. One of the questions is, why are K-2 prioritized? Also, what are school districts addressing? How are districts addressing the emotional, physical needs of secondary students? And how will person in classes work for K-2 teachers who are at risk and cannot return to in-person classes?
So I'll take the last one because I can remember that. I think we're working with our staff to make sure that they're comfortable to return to in-person learning as well. We have a very robust virtual learning program in the Central Valley School District that as that need arise, we may be moving staff who are uncomfortable to return. We may offer them the opportunity to return to a virtual learning piece. I think the social emotional piece, in the Central Valley School District, across all grade levels, we have created an outreach team. And our outreach team is made up of our social workers, our counselors, principals, with our director of safety and security. And that outreach team is there to help our community, whether that's parents or whether it's students who may need help or may be struggling during this time, not only with academics, but maybe it's outside of academics in school. And so that outreach team takes referrals from our principals. We outreach to them. We are already outreaching to parents and families who have not yet engaged, but we know our students and our responsibility in moving forward. We have built in social emotional learning time in every single one of our schedules. We have advisories at our high schools. We have a social emotional learning time at our middle schools and also our elementary schools. As we move forward with phasing in beyond second grade, one, we've created mileposts for our board to weigh in on the appropriateness of appropriateness of phasing in other grades. So we will continue to have our board involved in that process. But as we move forward, that will be calibrated based on Dr. Lutz's advice as to what is happening with cases and the advisability of moving more children back into in-person learning. So just wanted to follow up on the question that Dr. Swinyard took. We are planning to move our 3 through 12 into in-person learning as well, and we'll be ready to do so when it is appropriate.
I would say relative to K2 students, that's per Dr. Lutz's guidance, and I'm sure that he can speak to his thoughts and opinions related to the potential public health impacts of having our youngest learners not in our school buildings, both from an academic standpoint as well as their social emotional state. And we recognize that there is a significant difference between our K2 students' ability to engage in distance learning and our students as they move up the grade span. The structure of their day, the way in which we provide instructional activities to them is interactive. It involves movement, and it involves a lot of interaction and close support by the teacher. So to utilize those strategies in a distance environment and to maintain their engagement is difficult for those students. We also recognize that there is a significant impact to childcare for our community and the role that that plays on our families and the overall well-being of Spokane and Spokane Valley. So we have continued to be focused on K2. We are also have laid plans to return our older students when we receive the guidance to do so. And similar to the Central Valley School District, the wellness of our students and our preparedness to respond to the significant trauma and impact that they have incurred over these months has been a central theme of our discussions. Our counselors, our intervention specialists, our mental health therapists are all standing ready and are working to outreach to families to connect with them. That looks a variety of different ways, depending on the student's individual needs and our ability to connect with them. But we are being very intentional about who's engaging, what interventions they need, and how we can come alongside that family and support them through this challenging time. And we've also added intentional time each day for elementary through secondary students to participate in social emotional wellness activities and curriculum.
Great. Here's another question for both superintendents. Walk us through what this is going to look like. Will it be 5 days in person, 2 days? Will virtual learning continue for those that don't feel comfortable in person? And will PPE be available for teachers and students?
So I'll talk about our phase in just quickly, and we'll start on Monday, October 5th with half of our kindergarten students. The other half will not be in an academic setting. They'll be preparing and working to come to school the next day. So Monday will be half of our students. There'll be 7 or 8 students per classroom on Monday, and a different 7 or 8 students per classroom on Tuesday. And then on Wednesday, we will go full day with all students. And then on Thursday, we will have full day with all students. And on Friday in our district, we have a learning improvement day. And so it's going to give our teachers a really good break to really collaborate, talk about what's working, what isn't. And it also gives our learners a break on Friday. So there's going to be this phased in approach for us in the Central Valley School District. I remember when my son was in kindergarten, and that first week he came home and crashed. As soon as he got home, he was crashed on the couch. And I expect that same stamina will need to be built with our kindergarten students as we return. We will have personal protection equipment available for those families who cannot supply it, so that it will be available. And if our students want to continue with virtual learning, we will place them in a virtual learning environment. I would like to thank our county. Spokane County has really stepped up both in CARES dollars to the Spokane Public Schools and school districts across the region, but also in supplying personal protective equipment. And they have been very generous in making sure that we have the equipment that is needed to return to in-person.
Great, and we have time for two more questions. Two-part question. Let me find it here. What will transportation work for busing students? And then the last question is, what are the districts doing to ensure they don't close and go completely back to remote learning only a few weeks later?
So we will provide transportation to our students consistent with our past practice. So our kindergarten families can expect that that option will be available to them if they so choose. And we will continue to closely coordinate with Dr. Lutz on the conditions of Spokane County and the conditions of our schools. Again, following the safety guidelines and protocols will be of paramount importance, and that will be our focus as we support the training of staff and students, as well as reinforcing that expectation. And again, we cannot advocate enough that our community as a whole follows the social distancing guidelines and the mask requirements and are very thoughtful as they're moving about their daily lives in our community. That's the best way and the fastest way to get our students back into school is a community-wide effort to follow the guidelines of our public health officials.
I would echo Dr. Swinyard. We in the Central Valley, regarding the precautions that we're taking, we will screen every single student who enters our building for symptoms and also a temperature check every single day. We're going to ask our parents to attest that the symptoms, that their students are symptom-free, but we will do a temperature check every day on every student that walks into our building. Our staff has to go through that same attestation process and same health screening for them. We also have very robust incident response. So if we have a child who is symptomatic, that child will go to a room in our building. We'll ask that parent to come pick them up. We'll ask them to follow the guidance and either get tested, go to a doctor, or stay out of school for 10 days. But it's really, really important that our community gets behind all of this, as Dr. Swinyard was talking about. For us in the Central Valley School District, we'll be running our buses at about 50% capacity. And the reason why that is important for us is because we want to maintain the ability to continue school in person. And if we have too many children on a bus and somebody comes down with a positive case of COVID, that means that it might affect more of our cohorted classrooms in our building. And so we're asking our parents, if you have the wherewithal to transport your own child to school, that you plan to do that, especially as we start to phase first and second grade in. When we surveyed our parents last spring, about 80% of them said that they would be willing to transport if we had social distancing measures on the bus. And so we'll be asking our parents to do that. We'll ask our parents to transport, come to valet. They will be screened at the valet so that they know that they're coming into the building symptom-free as well. And we're going to discourage, at this point in time, sending kindergartners in groups to school walking because we need to make sure that they're social distancing through that process. So we're going to have a webinar for our kindergarten families on Wednesday, September 30th, where we'll go through much of these expectations and really talk to our parents about how we need their support to continue to be in-person learning and not shift out of in-person to remote learning regularly. We want to maximize the amount of time we have with our kids.
Those are consistent approaches in the Spokane Public School District. Our parent webinar will be Tuesday at 6:30 p.m. And we also are prepared to conduct contact tracing. And so we have a team of staff that have been trained to do that work. And following the protocols, prevention will be our first approach. In the event there is a case, we have that contact tracing team trained and ready to go so that we can quickly respond and make sure that we've taken the steps that are necessary to ensure the safety of others.
Sandra, Dr. Lutz was going to weigh in, I think, on the mental health piece, and maybe he wasn't able to, and I was just wondering if he wanted to.
Dr. Lutz?
Yeah, thanks, Ben. Yeah, actually, it was more along the lines of why early learners. And I think, we've talked about this before. When the state guidance came out recommending remote, it did emphasize the importance of early learning as a group, early learners as a group to focus on. And the Office of Superintendent of Public Instruction identifies early learning from birth to third grade. As Dr. Swinyard noted, however, there are very distinct differences with K2 versus once you get into third grade. And that's why, again, looking at all of the data, we felt most comfortable with focusing on children under the second grade for our initial focus of phasing in students into schools.
Great. Thank you, Dr. Lutz. Well, that wraps up our media availability call today. Just to let you know, if you have any questions, feel free to reach out to me. And I happen to know that both school districts have amazing information on their website if you need any other questions answered. So thank you, everybody, for joining us. Have a good day. Bye-bye.